Hello, I'm Danielle Fortingo, founder and lead nurse practitioner at Cameron Health. For this episode of Cameron Health Healthy Minute, we're going to talk about diabetes. Diabetes affects 34 million US adults, and sadly, it is the seventh leading cause of death in the US. Today's conversation will be focused on three areas. 1. What is diabetes? 2. Who is at risk and how to get screened? And 3. How to manage your condition. Let's start. What is diabetes? Most of the food we consume, mainly carbohydrates, gets broken down into sugars in our bloodstream and is used as fuel. However, excess sugar in the bloodstream damages organs like our heart, our kidneys, and even our eyes. When someone has diabetes, their pancreas is unable to produce enough insulin to break down the sugars in the bloodstream to be absorbed by the cells as energy. So this allows excess sugar to remain in the bloodstream, which eventually can damage vital organs. There are three main types of diabetes. The first one is type 1 diabetes, which is an autoimmune disorder where people are born with the disease. Then we have type 2 diabetes, the most common form of the disease, and is usually attributed to lifestyle factors like obesity. And lastly, we have gestational diabetes, which happens when a woman who is pregnant develops abnormal high blood sugar levels during the pregnancy. For today's conversation, we're going to focus on type 2 diabetes, which accounts for 90% of all diabetic cases. Although some genetic factors may contribute to the onset of type 2 diabetes, the most common risk factor is being overweight or obese. In fact, being obese makes you 80 times more likely to develop type 2 diabetes than those with a BMI of less than 22. Number 2, who should get screened for diabetes? The American Diabetes Association now recommends diabetes screening tests for any adult who has certain risk factors like overweight, obesity, physically inactive, and a close family member with a history of diabetes. Given the high rates of diabetes, especially in the African American community, who are 60% more likely than whites to have type 2 diabetes, I generally encourage my patients who meet any of these criteria to get screened for type 2 diabetes. So please visit your provider to discuss your risk factors and get screened. Finally, let's talk about number 3, managing diabetes. If you've already been diagnosed with diabetes type 2, I have 4 specific things I recommend you to do. Number 1, test your blood sugar using a device like this before and after meals. Ideally, you want your pre-meal blood sugar reading to be between 90 and 130, and then your after meal, which is a post-meal level, to be less than 180. Number 2, see your physician at least twice a year and test your hemoglobin A1C, which is the measure of your blood glucose in the past 3 months. As a diabetic, you want your A1C to remain below 7. I personally like my diabetic patients to keep their A1C between 6 and 6.5 if possible. Number 3, make healthy life choices by going for a 30-minute walk a day. Goes a long way to improve your blood sugar levels. Reduce your carbohydrate intake, and adding vegetables to your diet also helps maintain a healthy blood sugar level. Research also indicates that losing 7% of your body weight reduces the risk of diabetes by 58%. So I'll definitely encourage you to set a weight loss goal and achieve it if you're obese or overweight. Number 4, lastly, Take your medications as prescribed by your physician to manage the diabetes. Failure to follow your treatment can lead to complications such as kidney failure, heart disease, nerve damage, and strokes. Hope this information was helpful. That is your Cameron Health Healthy Minute. Please visit us at www.cameronhealth.com to schedule your consultation. Thank you.